vaginal bleeding. Usually the problem is irregular periods and heavy vaginal bleeding. It is usually more common with the copper IUD, but it can happen with the hormone IUD as well. So women have described very heavy bleeding with clots, changes to their period pattern with prolonged bleeding, and experiencing unexpected bleeding episodes. Whether it's spotting or heavier, it's just not expected. Some complain of just continuous bleeding since they had the coil fitted. Again, we believe the abnormal bleeding pattern and the excess amount of blood lost are due to inflammation triggered by the IUD being inside the womb. But we think that this bleeding often reduces with time in most women, and those who are on the hormone, that's the progesterone IUD, will experience less frequent bleeding, especially after the first year. Some women can gain some relief by using non-steroidal anti-inflammatory medicines like naproxen or drugs like tranexamic or mefenamic acid to control bleeding. The next concern that many women have about the IUD has to do with different side effects that are related to the progesterone within the coil. So this is now specific to the progesterone IUD. They include problems like acne, breast soreness or tenderness, mood changes, headaches, and so on. Now, they can happen to different degrees, but women with these complaints usually experience relief after they've stopped using the IUD. Some women using both the copper coil and the progesterone or hormone IUD also complain about a loss of their sex drive. However, there isn't enough proof to indicate the coil, whether copper or progesterone, causes this problem generally, because some women feel no different with their sex drive using these methods, and for some, their sex drive gets better. So if a woman is concerned that her libido has dropped or reduced since using or since fitting the coil, we would consider other possible causes, and if addressing those makes no difference, it's a good idea to remove the coil. So these are some of the more common side effects that women experience with the IUD that makes them not very keen, dislike it, or just want it taken away. So let's leave side effects, because there are still some other reasons that women say they can't stand the IUD. First,